Hey everyone, grab a seat and get comfortable. You are entering the Smartest Doctor in the Room podcast. Mast Cell Activation Syndrome, or MCAS, is a very trendy but controversial diagnosis in the medical community. There are doctors who think that it's a made-up diagnosis to satisfy patients suffering with a myriad of unexplainable symptoms. And then there are doctors like myself who are seeing cases every week. You know, mast cells for many years were only associated with allergic conditions, but now the activation of mast cells has been implicated in many conditions such as long COVID, chronic fatigue syndrome, or myalgic encephalitis, and I wasn't even aware, even in autism. My guest today, Dr. Theoharis Theoharides, I hope I'm saying that right, is an expert on mast cell activation syndrome. I actually call him the master of the mast cell. He has published so many articles, excellent scientific papers documenting what mast cells do when they're overactivated in our body and the medical consequences. Dr. Theoharides is affiliated with Tufts University School of Medicine in their Department of Molecular Immunopharmacology and Drug Discovery Laboratory. He's also affiliated with the Neuroimmune Institute at Kiran Patel College of Osteopathic Medicine at Nova East Southeastern University in Fort Lauderdale. So I am really excited to welcome Dr. Theo Hardy to the podcast.
Well, it's a real pleasure, my friends. This is a very, very important topic, and we should try to get to the bottom of it because it's been confusing both colleagues and patients alike, and it's only getting worse.
I agree with you. I think we are. I'm really intent on doing that today.
Good.
I wanted to mention that, my original training was in allergy, infectious disease, and immunology. And as I said just in that intro, we were taught that mast cells were important in allergic diseases, the whole binding of what we call IgE on mast cells, which then caused the release of histamine. And that's why patients got sneezes, wheezes, all the allergy symptoms. I was just curious with your background and when you became interested in mast cells and made you even look at their effects beyond allergies?
It's very interesting that you're asking me that. So I was a graduate student at Yale University, from which I also have my MD degree.
Hmm.
And as part of my qualifying examination, I had to come up with a secretory cell and try to ask a question, which in those days, and I guess to many places still to this day, had to be formed into like a small grant proposal. And you were supposed to defend the grant proposal and what the potential outcome might be. And I would ask you questions about background, this, that, the other thing. And I wasn't quite sure what to do, except that I had visited some friends at Albert Einstein College of Medicine at the time that they used to have a duel, they might still have it, between professors. And the duel at that time was among Sam Zeifter, a professor of biochemistry who unfortunately passed a few years ago, and Jacques Paduer, a professor of histology, who may still be alive, I apologize, and he was on mast cells. And I was like absolutely blown away because Sam Zeifter was saying what a wonderful cell. It's got 1,000 granules. It can make 500 different mediators. It's got to be important. And Jacques Powder said, no, it doesn't do anything in the body
That's
because
what,
he
yeah, that's what,
because he had done a very important experiment.
uh-huh.
He had actually injected in the peritoneal cavity rats with colloidal gold particles.
Okay.
The mast cell uniquely not only synthesizes, but takes up molecules from the environment. So it took up the gold and deposited inside the granules.
Okay.
So the question that Dr. Potter asked is, if the mast cell is doing something every day, then over time, and he was killing rats until they died of old age,
Uh-huh.
the colloidal gold should be secreted if the granules were secreting. Yet the colloidal gold was still there.
Hmm.
So he said that under normal, quote unquote, culture conditions for the rats, if I can call them culture conditions or whatever, the mast cells were not doing anything.
Hmm.
But again, those rats were not exposed to anything
Right.
that
Yeah.
might have been triggers. So
Right.
ever since that time,
When was that, by the way, if you might tell me? Like,
oh my
what
God,
year are
that
we
was
talking
like
about?
1972, maybe
Wow.
thereabouts,
Well, I mean,
thereabouts.
because, it wasn't until 1967, just for my listeners, just to get some context here, that something called immunoglobulin E was discovered
Correct,
by the
correct,
Ishikawa, the
correct,
Japanese
correct.
American researchers
Absolutely
at
true.
Denver. And that kind of opened up the understanding of allergy, because prior to that, too, in the world of allergy, there was, like, quote, this serum factor, this mysterious thing
Yes.
that made people with hay fever. And, again, also, I always tease, on the podcast, my colleagues, like, for years thought, allergy was voodoo. It wasn't real
But
science.
then there was evidence that there was something going on long, long before that.
Yeah, like
So
transfer
back
factor or
in
something.
no, 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 in 1901, okay, 1901,
Yeah, yeah.
an experiment was done out of the Oceanographic Museum of the Principality of Monaco. Two scientists, Porquier
Yeah.
and Richet, decided to do the following experiment. They took jellyfish tentacles
Okay.
because men of war were rampant in the area, and they
Yeah.
were going to inject them into dogs,
Uh-huh.
and they would allow the dogs to somehow create something protective so that when they would re-allow the jellyfish to sting them, they would be protected. And they
Right.
had a term ready for it. They were going to call it prophylaxis.
Right.
Instead, the opposite happened. The
Right.
dogs dropped their blood pressure
Anaphylaxis.
and they called
Right.
it anaphylaxis.
Right.
So that was 1901. In
I didn't realize
18,
it was that long ago, but
yeah, yeah.
okay.
In 1887, just a few years apart, Dr. Paul Ehrlich identified the cells and named them mast cells because,
Ah,
and that was his doctoral thesis, by the way, in Germany.
okay.
So he was using a dye called toluidine blue, and for some reason, some cells in the skin turned violet. And he didn't know what they were, but some were compact, some were a little looser, and he could see little
Yeah.
dots.
Right.
He thought that they were feeding surrounding cells, and by the name of the Greek word for breast, mastos, like mastectomy,
Oh, I
he
always thought
called
'cause
them
it looked
mast
like the
cells.
mast from like a sailboat. So no,
No,
it's
no,
the
no. He
uh,
called them mast cells because they thought like the breast feeds the baby, they
oh,
were feeding surrounding cells. And of course, they don't do
interesting. Oh,
that.
that got a little good history
So,
here.
but that connection was never made between anaphylaxis and mast cells
Previously. Yeah.
until 1947, when histamine was discovered in mast cells.
Ah,
And
ah,
then, as you correctly stated, it was until 1967, 68 when
right,
the IgE was discovered. But to
right.
take you back to the jellyfish,
Yeah,
the dogs do not necessarily become sensitive to the molecule in the genital tentacles. This is a peptide like wasps. It's called mastoparani wasps. In
yeah.
jellyfish, it's called something else. And that triggers the mast cells without necessarily being allergic.
Yeah, yeah. We're going to get into that. All right.
Right. So we
I'm having a
knew
little bit
from
too much
back.
fun here because you're giving me such an amazing history, but
All right.
I want the listeners to not lose interest. Okay,
Sure,
I want
sure,
to get
sure.
into this about, and I think this is so important, why mast cells are so important. Now, again, this is how I explain it to patients when I see them in my office, and I make them smile. I explain to them that mast cells are not just for, regarding allergic patients, because that's how I was taught. I mean, like I was taught back in the 1980s, these mast cells, they're important in allergic patients. Otherwise, they're not so important. And I always used to say to myself, why would God invent a cell that's only important for allergic people? That doesn't seem right.
Absolutely true.
So I would like you to please explain as a little bit as simplistic as you can why, like a little bit, the mast cells function and role in the immune system. And I'd like you to bring up too, because I thought about this even right before we went on today. Like, why are these cells so unique compared to other white blood cells? I mean, it's mast cells are in that, right? They're in from that
Okay.
origins of white blood cells. For our listeners, like neutrophils or eosinophils. But it seems like mast cells have all of these, as we're going to get into a little bit more, a lot of fascinating aspects to them.
Right.
So,
So I actually wrote a review recently and I called them the master conductor.
I'll have to
So
get that paper. Okay.
I'll send it to you.
Thank you.
The important thing to remember is number one, that the mast cells have existed for like 30 million years.
Okay.
Lizards, fish, octopi,
I mean,
mollusks
it's
have mast
everywhere.
cells.
Right, right. That's
And
impressive.
obviously they don't get allergic reactions. So they must be doing something else.
Right.
So both I and some select quote unquote colleagues feel that the mast cell was actually playing the role of what is now separate hormonal system, endocrine system, neuronal system, immune
Mm.
system in species that this had not been developed. Because the
Mm.
mast cells to this date literally make pretty much every molecule known in endocrinology or immunology on their own right. So
Wow.
therefore, they had the ability to function as an endocrine cell, immune cell,
Oh my
neural
gosh.
cell.
Wow.
The mast cells make all the hormones that the pituitary makes, for instance.
Really?
Oh,
Yeah, I saw that
absolutely.
in one of your papers. I was like,
Yeah,
'cause I see this. We're gonna get into this too. Again, I just want our listeners to appreciate this because I do, as I said, see a lot of patients with mast cell activation. I have so many people. I hate to say this, Dr. Theoharides, but sometimes our patients seem to be more educated than the vast amount of physicians about this.
right.
So everything you're saying, I think anyone who's listening, who's suffering from this or knows someone that is, can
But let me
appreciate why
also
these cells are
mention
so important.
you led to important wise certain useful function of the mast cell. And there are
Yes.
many that we don't understand. Okay.
Okay.
One useful function is we cannot heal wounds without having the mast cells. We've
Hmm.
published papers where we created diabetic wounds in mice, and mice that were deficient of mast cells, they would not heal.
Wow.
Because if we were to take just the healing process, the mast cell is doing something amazing on its own without our trying to regulate it. For instance, they will first release molecules that will debride the wound. So there's enzymes, proteolytic enzymes that will
Hmm.
clear the wound.
Uh-huh.
Then we'll release molecules that cause angiogenesis to bring more vessels to allow the wound to get more blood and heal. And
Wow.
eventually, they will release fibrotic molecules that cause the keloid that closes the wound at the top. So mast cells are needed for every
Oh,
one
they're
of these three
critical.
levels,
Wow.
but we
Wow.
don't regulate it. Somehow, either the body knows or the mast cell knows where to stop and where to start. I wish we could actually do that at will because we could be solving a lot of diseases, frankly, if
Yeah.
we could do that. And
Can I
none
ask you
of
a quick question though, too? Is
yeah, please.
because I asked a top expert and he really didn't know the answer to this, but I have a feeling you will. Histamine, which is such a basic molecule in the mast cells, it can't be there just for allergies. Does it play an
No,
important role in inflammation or our immune system?
absolutely yes. At least three major roles. One is it does stimulate blood vessel swelling that allows blood to come into an area and then bring in whether
Uh,
it's immune cells or
for
other cells
healing.
or
Okay.
platelets to clot or whatever. Okay, that's what we call the triple response of Lewis. So
Yes.
you get swelling, you get itchiness, etc. It stimulates sensory nerve endings and sends messages up, I hurt, so that the body then will react accordingly. But
Hmm.
in the brain, which I wish we might have time to talk today or maybe some other time, we have as many mast cells in that critical part of the brain called the hypothalamus that regulates homeostasis
Really? Wow.
and amygdala that regulate
Yes,
behavior,
that has to do with anxiety and people.
fear, all of that.
Right. Wow.
But histamine is found also in nerves that release histamine instead of releasing other neurotransmitters. So
Uh-huh.
whether the histamine comes from the mast cells in the brain or the neurons, it is important for motivation and learning. If we shut down histamine in the brain, we're not going to do well. We'll create dementia, actually.
That's so
That's why
interesting because people, we're going to get into a lot of things, but you say every sentence you say is so important because, as you know, too, a lot of people we're going to get into this are on antihistamines all the time, and
I've always been arguing with my colleagues, don't go overboard.
right
Don't go for
selection.
way too long a period of time.
Yeah, we're
Be
going to.
careful, especially in elderly patients.
Great point.
Yeah, there
Great
was there
point.
was a paper that had published the information that in elderly patients that were taking antihistamines for like a year,
Yeah.
either we had early problems or the dementia
Right.
got worse.
Cognition issues.
Yeah.
Yeah. Hmm.
However, that's not true for everybody.
I
So,
understand.
because
Sure.
other people went overboard. But I've heard people giving like 200, 300 milligrams
R-
Benadryl a day. I would never, never in my
right.
life do
Right. And then
that.
sometimes people are also on these medications because they deem them as safe daily for years. And I mean, that's why we'll get into later. I do immunotherapy and stuff like that to try to
Right.
rebalance the immune system
Well,
instead of.
yeah, keep also in mind that the all tricyclic antidepressants are
Mm-hmm.
also anticholinergic,
Mm-hmm.
and the antipsychotic, like phenothiazines, are
Yeah.
also anticholinergic and
Yeah.
antihistaminic.
Yeah.
So if you give too much of a combination of this, not only will cause problems in the brain, but you can get into retention because you won't be
Mm.
able to urinate. So these things are
Yeah.
not necessarily safe, and they're
Yeah.
contraindicated in people with seizures as
And
well.
you know, it's so important what you're saying because again, what's really been taken out of the doctor's hands, all of these medications now are over the counter. So
Correct.
you know, I always just look for our listeners. Dr. Mitchell's mantra is the most dangerous medications are the ones that you don't need a prescription because when you can continually to take something on your own, like in perpetuity, something is not necessarily good about that. And just
And
because it's over the counter doesn't mean it's safe.
there's so many actually drug interactions, drug food interactions.
Yeah.
So absolutely true. You've got to
Yeah.
watch out what may or may not happen with anything that is OTC or
Yeah.
supplement or whatever.
Yeah. You know, one of the things also I learned from one of your papers, this is way before I got to know about you a little bit better. You know, I was kind of diving into mast cell activation the last several years. You know, I knew about mastocytosis, but this mast cell activation was kind of new. A lot of people in the allergy community were not talking about it. It was really in the functional medicine community. And then I saw some papers from by Dr. Castells at Harvard, who I really like a lot. And
Hmm.
then I saw one of your papers. Um, Probably in my journal of allergy, and it was really fascinating to me because you're even touching on this now, and I'm looking at a picture right now as we're talking, like how mast cells are in so many places I would never imagine. I mean, being in the heart, being in the adrenal glands, being in the uterus or genitalia, you know, genital urinary tract. I mean, this was just so eye-opening and explained so many unusual symptoms that I was seeing in these patients. With mast cell activation. I guess one of the quick questions I think my listeners, because they sometimes confuse this, and maybe it's the same, maybe it's different. How would you explain the difference between mast cell activation and histamine intolerance? Are they kind of really two
Oh,
different
very,
things?
very, very different. Even
Very
though the
different.
oh yeah, yeah, even though they can coexist. So
Yeah.
by definition, histamine intolerance means you cannot break down histamine. And we've
Okay.
got two enzymes. One is diamine oxidase, and the
Right.
other is a methyltransferase.
Right.
And either they're oxidized first and methylated second, or vice versa.
Yeah.
And there have been many cases. Now there are actually all kind of websites of people, especially with diamine oxidase deficiency, and
Mm-hmm.
you can look at that two ways. Either you can look at the gene, and the gene could have a mutation. If the mutation doesn't lead to a serious problem, as you know, we call them polymorphisms. So you can be heterozygous or could be homozygous. If you're homozygous, you really cannot break it down.
Is there a
But
way of genetically test? You can get a gene test for that? Is
yeah,
that?
yeah, many
Yeah.
companies do that.
Okay.
Unfortunately, many companies don't do just that. And in fact, this
They do a
Thursday, I'm talking
whole.
to a company whom I would try to encourage to make just a panel of 10 genes that I think are very important, because
Right.
otherwise you end up paying $300 and they give you all the
Right.
genes and you
And
don't
you
know
get a
what
whole
is
mess
going
of
on.
things you don't even know what to
Right,
do
right,
with.
right.
Right.
In Europe, certain labs can actually measure diamine oxidase activity in the blood, not just the gene.
Hmm.
Uh, for some reason, no one does it in the States. I mean, you can do it in a research lab, but
Yeah.
not in a clinical lab. So that is histamine intolerance, whether the histamine comes from mast cells or from food. And
Mm-hmm.
as we know, many foods are to be avoided by people that might have sensitivities, such as cheese, avocado, tomatoes, peanuts,
Right. So those are the big ones.
sardines.
Right. You know, I actually, there was once I've saved this. This is a paper I've had for like 20 years. It was a really good, it was actually in a dermatology journal, and it was talking about flushing syndromes.
Mm,
And they actually, in the paper, mentioned that obviously, you know, certain foods very high in histamine could induce the flushing syndrome. And they
mm.
listed like the four, which I always discuss with patients, as you were just mentioning: avocado, spinach, eggplant, and like Parmesan cheeses, because you can go a little crazy. You know, I mean, I do see that with some
Yeah.
patients. They go, I
By
have,
the way, spices have a lot of histamine, especially cumin.
oh, really?
So
Oh,
yeah,
that's
yeah.
good to know
So
too.
keep
Oh,
that in
good.
mind as well.
Yeah, because you know
Now,
sometimes people go a little extreme on these
of
diets,
course, of course.
and they have to be a little bit careful because
But I've got
otherwise,
to mention something else as
sure.
well.
Sure.
Histamine, if it is secreted in the blood, is broken down very quickly within a
That's right.
minute.
It's very hard to
Okay?
measure that. Right.
Right. If it is high, however, and
Mm.
sometimes it is high,
Yes, I've seen a couple of cases of that.
that means
Yes.
either that you don't have the enzymes to break it down,
Ah.
or that is released from the circulating basophils in the blood. Okay? Now,
Oh.
basophils are very similar to mast cells, but they
Right.
only stay in the blood. While
Yes.
mast cells come into the blood as precursors, and then they move out to the
And they go into
tissues
the
and they
tissue,
mature.
right?
Right.
Yeah. So just for our listeners,
But
you're getting like an amazing medical school instruction right here. I just want
okay.
them to
Well,
appreciate this.
here's where it gets interesting and complicated. So 30% to 50% of the people that have chronic urticaria, chronic itching,
Yes.
that are not helped by
Chronic hives.
antihistamines, yeah,
Yes.
chronic hives, that's where we do what is called the BAT test, basophil activation
I've been
test.
doing that now with my.
Right?
Yeah, we might get into.
Okay.
Yes.
So basically, what it is these individuals make an antibody that rather than being protective, they trigger the same receptor for immunoglobulin E. So it's like a
Yes.
gain of function, if you wish,
Yes.
antibody.
Yes.
So what the
Yes.
test is, you take basically blood from one patient that has basophils, you add the plasma from your patient, and if it stimulates release of histamine, that means you've got an autoimmune problem, and the treatment is very different for that. Okay.
Mm,
Um, Now,
okay.
many people have gastrointestinal problems, as you know. And
Yes, we're gonna get into that. I want to.
okay, I'll
Yeah.
stay. Then I'll talk
Yeah.
about GI
I
a
want.
little
There's
later.
one
Then
last question on this subject, then we're gonna move on because
okay,
I hope our listeners are staying with us because I find every word you're saying is fascinating. But this it's gonna move into what when we get to the clinical. So please, listeners, hang in there. It's gonna get even better. But one of the other things that's really important in this paper that I'm looking at you published in the Annals of Allergy, um, showed all the different receptors on a mast
yes,
cell and why, and it was a beautiful picture, by the way,
thank you.
and why it was so interesting to me because I like to try to explain this to patients because they're always so confused as we're going to get into the clinical symptoms. Like on a mast cell, like I had never before, there's what's called a cortisone, ACTH receptor that
Right,
or a CRH receptor. Now, for the listeners, again, these receptors mean when you're releasing certain hormones or stress hormones, the mast cell is going to be activated, as with estrogen. There's also what's called a beta adrenergic receptor. Again, that has to do
right.
with, some of you may be on beta blockers or, but this is what affects blood pressure and heart rate. And in just a couple of minutes, when we talk about all the different symptoms with this mast cell activation, that's why I believe you're explaining this is happening. And the last thing, again, I just don't want to get too technical on this, but again, I didn't know until I was reading again one of the recent papers that there's now also been discovered a new receptor, this
Correct,
MRGPRX2,
correct,
which is
correct.
like a coupling protein. And that what does that do? That explains why, like with
Okay,
drugs or
that
whatever,
that
what people are
explains how
getting.
mast cells respond to any drug or other trigger that has positive charges. So we call them
Hmm.
cationic. Many of
Yes.
them, many
Yes.
drugs are
Okay.
cationic,
Yes.
etc. But this receptor is what we call low affinity receptor. You have to have a lot of the trigger for
Oh.
these receptors
Okay.
to be engaged. In
Okay.
contradistinction to receptor for CRH that you mentioned before,
Right. Right. For
which is
cortisone.
corticotropin releasing
Yeah.
hormone released under
Right.
stress, that
Right.
doesn't require very much.
Interesting.
Uh, but what is critical to keep in mind is the mast cell is not static. Not only is found
Right.
in
We're
juxtap.
supposed to have that, but it has to be in a stable state. And we're
Well,
going to talk about that.
we must put it into stable
No, I
state.
know, but with these
Otherwise, it's
patients, it's not. I mean, we're going to get into some of the diseases, but one quick thing I want to point out too. Again, this happens. I mean, I think in any doctor that really thinks a lot about conditions, which I like to think myself as one.
good.
It's like over the years, also I've seen a lot of patients with multiple drug allergies,
Mhm.
and the physicians who take care of them, the probably doctors, like throw their hands up, like this patient's crazy. Nobody can be allergic to all these drugs.
Right,
And
right.
then I'm sitting, or unfortunately, the patients with chemical sensitivities. They go to
Mhm.
a place. I mean, this is one of the most devastating thing of mast cell activation. Where people go into a supermarket and the smells or products, they're reacting. And I just realized that again, all of these things were really probably the chemical sensitivity, the multiple drug allergies were really all mast cell activation syndromes, or
Well,
to some degree.
no, they are. I used to lecture all over the world with a patient with systemic mastocytosis,
Yeah.
and she would give her personal history, and I'll talk
History.
about
Oh
the
wow.
science. But
Yeah.
every time we land somewhere, as you know, you have to go through duty free. So you're forced to smell about 100 different perfumes. She would
Wait.
actually faint.
Wow.
And then the behavior will change for a few hours.
Right.
And
Right.
she used to call it mastopsychosis because her whole
Ooh.
brain was going
Right.
crazy. She couldn't quite communicate. She couldn't quite, put things together, etc. So there's no question that the mast cells are doing a job on us, when they're not
Yeah,
regulated
I had a
properly.
patient, fortunately she passed away last year. She had a lot of medical problems, but she was also one of my most classic mast cell activation syndrome patients, and it broke my heart. She basically became housebound because anytime she went out, if she smelled like laundry detergent
Right,
from the neighbor,
right,
on
right,
the
right.
clothesline, she would lose her urination.
Yes,
I
yes,
mean,
it
it
happens.
was just unbelievable. Dr. Theoharis, we're going to just take a quick break and come right back. Okay, I want to ask you about clinical correlation, and I'm sure this is where our listeners are on the edge of their seats. Mast cell activation has been associated with multiple symptoms. That's why so many doctors are uncomfortable. They don't like it when a patient has like 10 different symptoms. They want you to have one or two. Um, and I want to go through a couple of these with you. And because again, we're going to get into this because right now, also, mast cell activation is primarily a clinical diagnosis. We'll get
Hmm.
into some testing, but for the most part, it really takes, I think, an experienced, open doctor to recognize this. Now, as you started to mention right before, GI symptoms like abdominal pain, bloating, diarrhea, it's quite a high percentage. According to a paper from Dr. Castells, I think it's like over 90% of the patients have GI symptoms.
At some point or another, yes.
Yes. Okay. And also, about 90% of the patients, this is where I'm looking at these triads or whatever, about 90% of the patients have some type of, I guess there's a lot of mast cells in the skin in general, have itching or hives or swelling.
That is for sure.
Okay. Now, the trickier ones are the neuro ones. Because
Hmm.
again, doctors didn't like this. So if you have headache and migraines, I think they mentioned about 80% of the patients with mast cell activation can have that, or brain fog, or poor memory. Um, you started to mention this a little bit earlier. What do you think that's from? You think the mast cells are just
All right.
releasing
First,
histamine in the
first of all, the
brain?
mast cells are everywhere,
Yeah.
not only in areas exposed to the outside, like, eyes, mouth, nose, lungs,
Mm-hmm.
skin, gut,
Right.
but it was shown beautifully some years back that the mast cells throw filopodia between the endothelial cells that make up the wall of the blood vessel, and they
Okay.
sense what's happening in the lumen of the blood vessel. In fact, that's how they find immunoglobulin E, because otherwise IG is circulating and they're the tissues. How do they bind IG?
Right. Right.
So that's why I call them the master conductor, because they will see potential triggers immediately, and they will set up basically now the orchestra, which cells will come
They're
in.
first line. I mean, that's what I tell
They're
patients all the time.
absolutely first
They're
line.
the
There's no
first line
question
of
about it.
defense. That's why they're so important.
Yes, yes. And in fact, one potential useful, long time ago maybe, function is, let's say you're stung by a scorpion or whatever.
Right.
The mast cells will release immediately enzymes that will break down the toxin. So
Ah,
we believe that, again, long time ago, that might be a function, but
right.
if it is not contained, it will go on then and it cause an
Right.
inflammatory reaction,
Right.
et cetera, et
Right.
cetera. So the
Interesting.
question is at least twofold. Molecules released from the mast cell directly into the tissue in question. So, for instance, skin. The mast
Yeah.
cells degranulate the skin, they'll
Right.
cause itching.
You get
And
those hives. Yeah.
histamine is only one of many molecules that cause itching. In fact, there's a molecule called interleukin 31, which is not measured in
Right.
clinical labs, that is much more potent pruritogenic
Yeah.
molecule
Sometimes
than
people with
histamine.
severe eczema, atopic dermatitis, or itching. Yeah.
That
Pruritus.
is high.
Yes. Right.
Now, they could also release the molecules that can go to other tissues. So let's
Hmm.
take the gut.
Yeah.
A paper was published in Nature with an editorial in the New England Journal of Medicine that histamine, either from food intolerance or from degranulation of mast cells in the gut, will release molecules, especially histamine, will sensitize sensory nerve endings, and you will get the feeling of abdominal pain. And
Hmm.
now I and other colleagues believe that what we call colicky pain in young children might be intolerance to foods, milk, etc. And
Mm-hmm.
that's why they express it as pain, because now we
Wow.
know it will
Huh.
stimulate the sensory nerve endings. And then we have the possibility of molecules released from the mast cells going through the gut blood barrier and through the blood brain barrier
Yeah.
all the way up to the brain. So a lot of the things we talk about gut brain axis
Yeah.
might be due to molecules released in the gut and going in the brain. This is
Wow.
why if I suspect or I know that there are a lot of GI problems,
Yeah.
I routinely ask for 3 measurements in the stool. Total histamine, because if
In the
histamine is
stool.
in the stool, if
Wow.
histamine is elevated in the stool, it only comes from the gut. Because if it was from elsewhere in the body, it would have been destroyed and we'll pick it up in the urine.
Right.
I measure eosinophilic cationic protein, or sometimes it's another protein called eosinophilic protein X,
And you
and
get that in the stool also?
in the stool also, and those
Wow.
trigger the hell out of the mast cells. And many
Wow.
times eosinophils go together with mast cells, especially
Right.
in parasites or
Mm-hmm.
things of that sort. And then
Mm-hmm.
I measure also calprotectin in
Yes,
the
that's
stool
mm-hmm.
because they will give me a better indication of inflammation.
Mm.
So I try to separate out, is there something happening in the gut or is there something happening in the rest of the body? Even though at the end of the day, treatment may be somewhat similar, but
Yeah, but that's a great
I
point.
still need to know.
You know, it's so funny because a lot of patients, I was just talking to somebody today, they order those GI maps, which I usually find useless.
Yes,
But
same with me.
yeah, but what you're the only thing that ever helps me with is what's called calprotectin. I mean, if God forbid someone's got a very elevated one, I'm worried about Crohn's or some kind of
All
inflammatory
kind of
bowel
things.
disease.
Yeah.
But I like the idea of, I don't know if I assume maybe they do it. I have to request it. Ask for total histamine or eosinophilic cationic
Yeah.
protein.
Unfortunately, some of the clinical labs like LabCorp and Quest bundle them together with other tests. So you can order just that. So for
Mm,
instance, we were talking about the BAT test before. In
yes,
order to get it, you have to ask the Urticaria panel 2. And then that includes a whole bunch of other antibodies that I find useless, but
right.
that's the only way you can find it.
Yeah,
If
yeah.
you look for BAT test, doesn't exist.
No, yeah, I've been doing it
So,
now with food allergy patients. We could talk about that after, but
right,
let me ask you too about cardio. You know, that is one of the most distressing things, and we're going to get into this obviously with COVID patients, is that it affects the vascular system. I mean, I see people having crazy either blood pressure spikes or a lot of them severe low blood pressure called hypotension or
true,
fainting.
true,
Why are they
true.
getting that? Is the mast cells
Okay,
line the blood vessels or they're near
so first
them?
of all, there's no question that they line up the blood vessels. 90% of the mast cells are around blood vessels,
On
and they
the blood
control. Oh
vessels.
yeah,
Yeah.
they control the contractivity of the mast cells, and they control the
Mm-hmm.
permeability of the blood-brain barrier as well.
Okay.
Number two, they line up the carotid bodies,
Oh
and
gosh,
as you
that's what I
remember,
thought something like
if
that.
we
Wow. Yeah.
squeeze the carotid bodies, we slow the heart down.
Right.
But it's not only through the vagus nerve; the muscles are involved.
Hmm.
Then both pacemakers in the heart have mast cells. And the coronary arteries are loaded with mast cells.
Oh my gosh.
In fact,
I hate to ask this. How do you know all of this? Is this from
I just read.
pathology?
I just read a
You
lot.
read everything. I mean,
So,
so, and we
but
know from like autopsies or pathology
oh yeah, yeah.
slides.
For instance, a
Because they have to wait. I'm
compatriot
sorry,
of
Dr. Yaris,
yeah,
because one of the things, again, I'm sorry getting a little technical for the listeners,
it's
but
okay.
let's say even in the gastrointestinal tract, from what I understand, to identify, to really make a diagnosis of mast cell activation, you need what's called CD203 or CD60. Well, CD63 is with the basophils,
Yeah,
but
no, no, 60,
CD203.
no, no, CD63 is in mast cells as well.
Right. So
Uh,
is that, I mean, is that how they knew that
no,
these cells were, or
I
just a
wrote a
standard?
couple of papers that numbers is not enough to call it. And
That's true. Right. Right. Just
I
because it's
was talking
there.
about the
Right.
irritable bowel syndrome
Right.
because only when the mast cells degranulate in response to IgE and antigen
Yeah.
do they release the content of the granules. And
Mm-hmm.
CD63 is sitting on the perigranular membrane. So
Mm-hmm.
during degranulation, the perigranular membrane becomes part of the cell surface and we can
Hmm.
measure CD63. But the mast cell releases numerous cytokines and other molecules without ever degranulating. So counting the number of mast cells will not necessarily tell you what they are doing.
So just because so if you identify that like, with the CD203 in the intestine, that doesn't tell you that much.
No, there are cases of intestinal mastocytosis.
Yes. Okay.
And we usually say in general, if you have more than 30 per
Yeah.
high power field,
Yeah.
that's likely to be intestinal mastocytosis. And we have to
Uh-huh.
stain the mast cells two ways,
Yeah.
both for the surface antigen CD117, as well as for the content of the granule tryptase, about which we can talk about, if we have time a little later.
Yeah, yeah. I want to get
But
to
the
that.
mast cells can be similar or normal in number, and they must still be activated to be releasing molecules. We'll never be able to see it.
Okay.
So looking for number is like missing the forest for the trees,
No,
basically.
that's a really good point. That's an
Plus,
excellent point.
plus in the
Yeah.
gut, when you do an endoscopy, you don't really know where to biopsy unless you have a lesion.
That's
So
true.
many of my
Very,
colleagues
yeah.
just biopsy blindly and hope for
Randomly,
the
yeah.
best. Yeah.
Mm, mm,
Dr. Miner published many, many years ago that most of the mast cells, according to him, were the ileocecal junction. So
mm.
I usually tell colleagues, whether you see a lesion or not, go for that at least.
Yeah, again, going back to our histology days, like the around the ileum, it was like the something called Peyer's patches. There's a lot of lymphocytes.
Correct.
Probably it's probably an
Correct.
inflammation area for whatever reason.
Correct.
All right, let's get into this too. And I know this is like huge. So everybody listening, like really take, as I always say, grab a seat. I know I'm on the edge of my seat here. I mean, again, what I said, what was eye-opening to me in my clinical practice. Again, I was 32 years I've been in practice. I practice mainly allergy. I do infectious disease. I do a lot of chronic fatigue patients. And then all of a sudden, COVID hit. And
Mhm.
all of a sudden, as unfortunately things evolved, I started seeing patients who were getting to me from various referrals that never had an allergy in their life, and all of a sudden they were down to eating four foods. Or I was seeing patients that severe fatigue, or like again, we were talking about what's called POTS, like postural orthostatic hypotension, their blood pressure rocketing, going up and down, and their only real history was that they either were infected with COVID or sometimes in relation to the vaccine.
Right.
So tell us.
Here's the catch.
Okay.
We published two papers. One,
Yeah, I have one of those. Great.
we
Yeah.
used recombinant coronavirus spike protein,
Yeah.
and we showed that it stimulated the hell of the mast cells to release pro-inflammatory molecules. But that happened through activation not of the ACE2 receptor, which is the receptor the coronavirus binds to enter the cells, but through toll-like 4 receptor, TLR receptor.
Yes.
And
Okay.
we used blocking antibodies to block various receptors, and we showed which receptor was responsible.
Right.
So the mast cell not only will be stimulated by the spike protein, it doesn't have to be infected by the cells.
No,
Still,
this is I want to ask you is that because I know with the spike protein, it infects what we call monocytes. Again, for our listeners, those are
yeah,
white blood cells that go around trying, they're like the Pac-Mans. They try to go out
correct.
there and destroy things. So you're saying the mast cells are not infected, but
They're not
they're,
infected. Both in the lungs, it's been shown, and we showed it in cultured human mast cells,
yeah.
that the mast cells are activated by the spike protein. And in all
How? I
honesty,
mean, wait, the spike protein in the monocytes in that other white
no,
blood
no,
cell?
no, no. So the virus
Just
is around us,
the viruses
and
are,
it's
let's
got
say an
spike
acute
protein,
infection. Okay,
right?
an acute infection.
Or without getting into vaccines, the vaccines
Yeah.
basically are
Are presenting the
producing
same thing.
spike protein in order for
Right.
the body to make antibodies.
Right.
So spike protein is around. So the spike protein is what triggers the mast cells. And that's very critical for the brain because numerous scientists have shown that the brain cells are not infected by coronavirus. So what is it that causes basically the neurologic problems? So now we believe it's the spike protein that gets into the brain either through the blood-brain barrier or through the olfactory nerve. And as you know, the nose gets affected by
And is that
coronavirus very quickly.
protein like just okay? So it's just like well, so it's not just viral RNA, like say
No, no,
fragments. I
no,
mean,
no. This comes from the actual envelope of the virus. So
mm,
whether the
oh,
virus is killed or
mm,
whether the virus eventually gives up
yeah,
or through means that
right.
we
Because this is
produce,
months later in patients a
of
lot of
course,
times.
of course. And colleagues from London have shown that they're actually depots of spike protein. They can hibernate and the spike protein keep on coming out.
Oh my
So
God.
so here's the problem. Not only they stimulate the mast cells to release molecules that are inflammatory, they
Yeah.
release molecules that break down the blood-brain barrier. So now
Mm.
more of this can come into the brain, but they reset the reactivity of the mast cell, which comes back to what you said. So now patients that never had a problem or maybe some minor allergies, now they're allergic to life. I mean, literally.
Yeah.
A-
No,
And
I have
and
several patients like this. It's very,
so
very challenging.
not only for the allergies, not only the mast cell activation, to which I'll say a word, but for long COVID as well. We've got to block the mast cells because antihistamines will not do much because the molecules involved are not histamine, are primarily cytokines, chemokines, and other
Oh
such
yeah. Okay, I'm gonna
molecules.
tell you some of my unique things that I do with patients. So
But
you're saying
just
great stuff,
taking this example,
right?
by definition, mast cells are activated by spike protein.
Yeah.
And what is that now? That's not allergy. It's not mastocytosis.
No, no.
And it is not necessarily mast cell activation syndrome, because unfortunately, a number of my colleagues keep on insisting that elevated tryptase is what defines whether you have syndrome. Okay?
No.
Because we have mast cell activation unspecified,
Right.
other mast cell activation disorders, and
Yeah.
mast cell activation syndrome. So
Yeah.
a group says that tryptase is irrelevant, the other group says it's relevant.
Yeah.
A paper was published 2 years ago
Yeah.
about which Mariana Castell, who was a good friend, wrote an editorial.
Yeah.
They looked at hundreds of patients with high tryptase. Okay,
Yes.
by high tryptase, more than
Yes.
11
Oh, more than
nanograms per
eight.
ml.
Okay. Okay.
11 it was. Okay, 80% of those had chronic kidney disease unrelated to mastocytosis. Look up Mariana Mastel's and tryptase. 10% had high familiar hypertryptisemia, and the remaining 10% were only mast cell activation syndrome. So they ended up saying the majority of the people that are out there with high tryptase, it's not due to mast cell activation syndrome. And this is why a paper came out again by the same group of people that
Dr.
redefined
Afrin or
criteria.
whatever.
No,
Yeah.
no, not
Yeah.
Afrin.
No,
It's
not
mostly
Afrin. Uh-huh.
Peter Valen and others.
Uh-huh.
And now they raise the bar. Now they say the cutoff is 15 nanograms
No, I
per
learned from Dr.
milliliter.
Castells. I've had personal conversations with her. She's fantastic. She even told me, which I picked up cases where she said, Dean, look, even if you see somebody with an 8 or 9 tryptase, be suspicious. And I picked up alpha hereditary tryptosemia in those patients.
Correct, correct. And with the alpha tryptosemia, which might be, a new kid on the block for many
Yeah.
of your listeners, even though the active tryptase is a beta tetramer, okay,
Mm-hmm.
that is inactive in the granules. It becomes active when it's released. In familial hypertryptosemia is the alpha-2 dimer, and alpha-2 is inactive.
Okay.
Yet, most of these patients have flushing, urticaria,
Okay.
GI problems. So
Right.
how can an inactive molecule be causing all these problems is beyond me. I still
Okay.
don't understand it.
All right. Well, if you don't understand,
Okay,
I'm sure nobody else in the
there you
world
go.
does.
So
Yeah.
you were about to say, what do you do for your patients?
Well, you want to hear what I do?
Yeah,
I'm going to tell you in a few minutes. I want to get so we
okay,
get the treatment. I want to ask you just one of the two quick things, and then we're going to get into treatment.
sure.
Um, Ehlers-Danlos syndrome.
Yes,
Okay, just for our listeners, and a lot of it's really funny when I was in medical school. Typically on the board exams, there was always a picture of an Ehlers-Danlos patient showing like their connective tissue. They had like very stretchy
right,
skin.
right.
That was like a classic. When I was in internal medicine, never saw an Ehlers-Danlos patient in my life, but sure enough, on my board exams, this thing was appearing. I had to know,
Okay.
make sure I knew it. And then once and again in over 25 years of practice, I never saw an Ehlers-Danlos patient. I guess it never got to me. And then once this whole thing with mast cell activation, I started seeing more and more patients. A lot of these patients said, "Oh, I also have Ehlers-Danlos syndrome," which can sometimes be tricky because it's not always easy to diagnose. A lot of it's clinical, or there are a few genetic mutations that will pick it up. But I was just wondering, Dr. Theoharis, if you know, why is this? Is there some kind of like genetic co-linking thing? Like, why do these patients
No,
have
you're
a higher
absolutely right.
percentage of
It's a
this?
mystery.
Oh, it's a
And as you
mystery.
know, we
Okay.
call it a triad because we talk about muscle activation, EDS, as well as POTS, as you mentioned earlier. They
Yeah.
seem to co-occur. The we were about to write a paper with some colleagues, and we haven't finished it yet because we want to do some biopsies. Let me
Mm.
suffice it to say that in EDS, there's some problems with the connective tissue. Okay?
Yes.
And connective tissue has a lot of components. It has chondroitin sulfate,
Right.
hyaluronate, dermatan sulfate, etc. Keep in mind that about 50% of the granules of the mast cells are heparin and chondroitin.
That's right.
We still don't know what they do. other than they're negatively charged, and maybe that's where histamine, because it's positively charged, holds on to. However, a student of mine got her doctorate degree about 7 years ago, showing that chondroitin and heparin act back and block the mast cells. So it's like an internal
Like a check, like a
break,
negative
like
feedback.
bracket
Yeah.
check, right? So could it be, we asked the question, that the defective connective tissue components in EDS cannot block the mast cells anymore in the skin? And now we have overreaction, therefore we see a lot more of mast cell activation. But the only way to prove that is to do skin biopsies and measure the components. And we haven't been
That's
able
really
to do
fascinating
that.
what you're saying now, because you're making me really flash back to, it was like the most bizarre thing. But when I was in training, and they and some of the articles that came out about treating anaphylaxis, which of course you treat with antihistamines, steroids,
Right,
epinephrine, they
right.
sometimes would say give IV heparin.
Yes, we used to say that, except that
It's
obviously
probably
IV
not
heparin
true,
could
but
cause
yeah, worry about
bleeding.
bleeding, right? But
Yeah.
I thought that was fascinating.
Right, but back those days, or it might be my days, but not your days. We used to use full heparin, while in Europe for many, many, many years you were using low molecular weight heparin
Right,
because it was not causing platelet depletion.
right.
Then slowly we started using in the States low molecular weight heparin.
Yeah.
So the kind of heparin you use would actually be helpful.
Hmm.
And Dr. Afrin and some other colleagues from Europe do measure heparin in the blood as an possible index of mast cell activation
Yeah, so I know
other,
that. I've talked to
other
his
than tryptase.
associate. Yeah,
Yeah.
Doctor, I forgot her name, but she works with him. She says, like, she mentioned that at a lecture I attended, that she'll measure the plasma heparin. Do you find that
Yeah.
helpful?
I haven't, and many labs don't do it.
Yeah, it's very
And it's
hard to get
tricky if
it.
you're going to do
Yeah,
plasma or serum. So
right.
it's not that useful, but I'm just saying we've got to come up with more objective measurements of mast cell
Well, actually,
activation.
one more thing I wanted to ask you before we go into
Sure.
treatment. I want to get to treatment before we finish up. Like N-methylhistamine in the urine, 24 hours,
Uh,
prostaglandin D2, chromogranin A. I have never found them to be that useful because I see up, down, not, do they help in mast cell
okay, first
activation
of
or?
all, chromogranin A, in spite of what the colleagues say, doesn't exist in mast cells.
Okay.
Chromogranin A comes from enterochromaffin cells, which are
Mm,
like mast cells in the gut, but they
mm,
release primarily serotonin, and it
mm.
causes carcinoid syndrome, which of
Right.
course is related to flushing and diarrhea and hypotension,
Good
very
point.
similar to mast cells
Okay.
release,
So that's
but
a
it's not
waste.
mast
That's
cells.
that's like
No.
a big misnomer. Okay.
And in addition, chromogranin A should be measured while a patient has been for a week without any antacids. Otherwise, it's a false positive.
Mm,
So no antacid, whether it's histamine 2 blockers or pump inhibitors. Okay,
mm-hmm.
at least 3 days. I prefer
Interesting.
5 days, etc.
Okay.
So methylhistamine is important because that's the primary breakdown of histamine. Although only
Okay.
about 30% of the histamine is methylated, then it becomes oxidized.
Okay.
So some laboratories used to measure what is called MIAA, methyl imidazole acetic acid. That's the final breakdown product of histamine. So if I
Mm.
were to find a lab that measures MIAA, that's the best.
But it have to be 24-hour too. You have to get like a whole lot of it,
It
or
used to be that. Now at least the major laboratories say morning void.
oh, okay.
So they'll
Guess we'll
do it
wait
in
and see.
morning void, but it has to be collected cold, shipped cold. If it
Oh,
stays at room temperature about 10 minutes, it's gone.
oh, Jesus, forget it. Yeah,
So it's
that's
very
not happening.
difficult. And
It's not
it's very difficult to
happening.
tell technicians when they get a urine in the lab, they have
Yeah.
to keep it cold before it actually measured. So it's
Yeah.
complicated. Now,
Yeah.
Dr. Butterfield from the Mayo Clinic and his colleagues
Yeah.
have published a number of papers, but one was uniquely important. They measured tryptase in the blood of what were otherwise considered to be mast cell activation syndrome patients by the book. Okay, so they measured tryptase, and then they measured prostaglandin F2 alpha, which is the brain down product of
Yeah.
PGD2, as well as leukotriene C4, which is one of the leukotrienes. Okay?
Yeah.
They found out that in only 20% of those patients, tryptase was elevated, while in 65% of the papers, the other two were actually elevated.
Hmm.
So there you go. So with those two, according to them, you can pick up more mast cell activation syndrome
Well,
patient
okay.
that
Oh,
replace
wait.
itself.
I'm going to tell you my big secret now.
Okay.
When patients come in, because of course they want a test that shows, do I really have this? And I said, look,
Yeah.
this is a very clinical diagnosis. I have them lift up the back of their shirt, and
Sure.
I take
Sure.
my,
Scratch their
I take,
back.
right, I take my tongue depressor, which they first they get nervous. I'm going for their mouth. I say, no, no, I'm just doing that, and I stroke their skin, and you'd be amazed how many people do not know they have what's called
Absolutely.
dermatographism.
I
I mean,
actually use it on the
yeah, it's probably
underarm.
easy. I should
So
do
that,
that. I
no, no,
wasn't
no, no.
sure.
It's not that it's easier. They can see it
No, I know.
themselves.
That's what I meant. It's easier to
Yeah.
see. Right. I don't know why. It must have been how I was trained, because we're always trained
Yeah.
in allergy that the back is a
And,
very
and obviously for
sensitive.
our listeners, that means that the muscles in the skin responded just to the pressure
Right.
and they caused release of histamine and other molecules that
Yes.
made the blood vessels leaky. More blood came in.
Right. I
That's why
always
it
tell
looks
people you could
red.
write, that's why it's
Yeah.
dermatographism. You could write your name
Right,
on it. I
right.
did a
So,
video on
so,
that.
so, so that
And
means that the mast cells are ready to fire.
right.
And we haven't uncovered to what as of
Why?
yet.
Yes. Okay. Let's go on to treatment because that's what everybody's waiting for. And
Sure.
that's why patients come to me. So I'm going to hopefully give away my secrets today, but I'm sure you have even better ones than I do. So I like to explain to my patients this because a lot of them, when they've been told they have mast cell activation, they're already on what we call an H1 blocker, like Allegra, Claritin, or Zyrtec. Some of them are on an H2 blocker, which we tend to associate with stomach acid, like famotidine or Pepsid. But this is what I end up using with patients, and I explain to them. I say to them, look, and correct me if I'm not explaining this correctly. Um, if you picture a glass of water, think of that as the cell, and it's filled with histamine, and the glass spills over, and the histamine leaks out. Antihistamines mop up the histamine. But what if we had a medication that stabilized the glass so it doesn't spill? Now, there is something called cromolyn, which some patients may have heard of, doctors may have heard of, but it only works locally, like in the nose or if you swallow it. But what I learned from a really good, actually, hematologist who unfortunately passed away at Columbia was he was having ketotifen compounded, which is an eye drop, which is a mast cell stabilizer antihistamine. And I've had some really good results with that. So I was just curious. I don't know. And I know we're going to mention a paper you sent me about something else, which is also a mast cell stabilizer, luteolin. So
Yeah.
maybe tell us about those two things. I think
Sure.
for
So
our
let me
listeners,
let me
this is the time
let
you
me
should be
start.
listening.
Let me start with the easiest approach.
Yes.
First of all, you've got to find out what may be bothering you and
Right.
eliminate it or
Very
reduce it.
important. Very
Whether it's
important.
foods, whether it's
Get the.
allergen,
I always like to say the mast cell activation is the top layer of the cake.
right?
What's
So
the lower layer?
just before we got on together, I was talking with the family of a 5-year-old boy in the country of Cyprus. Okay, and by clinical diagnosis, if I can call it diagnosis, he had mast cell activation. Okay?
Mm-hmm.
And he went to everybody you can imagine. Dermatologists, that's the other thing. And there were horrible problems. So before even doing the testing, etc., this was the second time I spoke to the family. I said, please, can you see if there's any mold in the house? And of course,
Yes. Everybody.
the
Yeah.
father just tore me to pieces. As it turns out,
It
the
was
whole
mold.
bloody ceiling of the room this child is, since he was born, was covered with mold.
It's so funny you say that because that's
So,
the other specialty that I do,
yeah,
and I like to say when if I put mast cell again the top layer of the cake, mold is one of the biggest activations. COVID and the other one, which we don't have time to get into,
I told
cancer
the
that
family,
overgrowth.
just do me a favor, just go away on
Fascinating,
vacation for a
and
week.
see how he does.
They came back from vacation. The child had absolutely nothing.
Wow,
Nothing. Okay?
wow.
That doesn't mean to say there was only the mold,
No,
but
I
there's no
know, but
question. And
it's a very strong
we've
factor.
published actually that
Yeah.
mycotoxins trigger the mast cells. Anyhow,
Wow.
so that's avoiding or minimizing triggers.
Amazing.
Then you choose an antihistamine that you can tolerate, because
Okay.
many people do badly or
Right. Well,
okay
they're
with
also sensitive to
antihistamines.
meds, and it's the
Right.
whole
So,
thing, right?
and try one that doesn't have any bloody coloring. Many of these
Hmm.
antihistamines have actually red color, and
It's
red color
silly,
we know
right?
trigger mast cells. Okay,
Right.
and then you can go up to 4 times the recommended dose. So if, let's say, cetirizine is 10 milligrams, you can go up to 40 milligrams if need be, and keep on going and give it a month to see how much it helps.
But why
Up
not do
to
the
the
mast
level.
cell stabilizer? I mean, I found that to be a little more effective. I mean, you're basically
No, they're not that good stabilizers. But
You
let me
don't think
go now
so?
to the
Okay.
ketotifen.
Okay, yeah.
Ketotifen is a very good antihistamine. It is not a mast cell stabilizer.
Oh, that's
The
what they say
only
it is.
paper, see, this is what happens. The scientific community picks up on something and then
Okay.
goes on and on and on.
Okay. I'm
The
learning.
only paper ever,
Yeah.
that doesn't mean to say that ketotifen is not good. I'll say a word about it. But the
Yeah.
only paper ever was actually on conjunctival mast cells,
Right, in the eyes,
where it
right.
showed that it blocked mast cells. Whether it
Okay.
was a good paper or not, it's in the
That's
literature.
it? Right,
But
okay.
no one has ever tried it to show that it inhibits mast cells anywhere else. But for some reason, when other antihistamines don't work, ketotifen seems to be doing a little better. And as you
Okay.
said,
All
we have
right.
it, for the eyes, etc.
Right.
It is very sedating. So you've got to make
Yeah,
sure
no,
your
I
patients
know how
know
to
that.
dose it, right. I've had to learn how to
That's
properly
okay.
dose that.
And it does increase appetite. Some people gain weight fairly quickly.
Oh,
So
that's
keep that
good.
in mind too.
I will. All right.
Depending,
So what about cromolyn, which again,
okay.
and your
So
luteolin that
cromolyn,
you sent me the
I
paper on?
published a paper on cromolyn in 1971 as a graduate
Wow.
student at Yale in the
Wow.
journal Science. Okay.
Hmm.
I'm saying this not to brag, but to say that it inhibits the rat mast cells extremely well. It inhibits the mouse mast cells somewhat, even though they're both rodents, and it's very poor inhibitor of human mast cells. Okay?
That's important to know. Okay.
And what is critical to remember is that it used to be the first time cromolyn came around was actually for asthma.
Hmm.
And because it is not dissolved easily, it was
Right.
irritating the lungs more than the asthma, so they
Right.
abandoned it. Okay?
Okay.
In the nose, as nasal crom, it tends to be pretty good because
Yes, I wanted to say that. Once I was
I
at a
like it.
meeting,
I
yes,
like it in the
right.
nose.
Well, that's why, I took it three steps further, but I'm so glad you're pointing all these things out because I was at a meeting once and it was when they were coming out with all the nasal steroids. And, of course, they had all these big allergy doctors getting paid by the pharmaceutical companies saying, oh, Nasonex, and this one's great.
Yeah.
And then they would show on the curve, like compared to cromolyn, they were like neck and neck. And I was
Yeah.
like, well, cromolyn is like not a steroid. It's so much safer. Why
Right,
wouldn't
right,
somebody
right.
want to take
Right, right.
that? And then I just
So
extrapolated
so
through
it's
that
good for
with
the nose. It is
what?
good if you have gastrointestinal problems derived from the gut because it's absorbed less than
Okay.
5% from the gut.
Yeah,
So it
yeah,
stays there.
yeah.
And what happens is the body develops what we call tachyphylaxis. It gets used to the action of the drug very quickly. So we usually start at 100 milligrams a day. Before you know, it's 400 milligrams 4 times a day.
Yeah.
And by that time, 50% of the people get explosive diarrhea, and another
Mm.
10% start having alopecia. So
Whoa,
you
alopecia, they
don't,
lose hair?
yeah, yeah. So
Holy
don't
mackerel.
push it too much. If you reach about 400 milligrams a day and it doesn't do anything, it's never going to do
Wow.
anything.
Okay, well, we got to find something that works. So what about the luteolin that you sent me? Because you
So
got me all
what
excited
happened
about
was,
that.
so there are hundreds of natural flavonoids.
Yes. Yeah,
We
people
see
always say,
them.
right, people like take quercetin. You probably heard this
Yeah,
too.
yes, we published on quercetin as well. So these flavonoids, think of them as cromolyn being a butterfly with two wings, and the flavonoids are the one wing. So they're
Okay.
very similar in structure.
Ah,
Okay? We showed in the recent paper, neck to neck, exactly the same amount of either cromolyn or luteolin using human culture mast cells, pre-incubated for 10 minutes, and we measured 10 different molecules released from the mast cells. Luteolin was 3 times better than cromolyn, no question about it.
wow.
And it does not show tachyphylaxis. The body doesn't get used to it.
Mm. And this is a
The,
supplement for our listeners.
yes, it's a
I saw that. I
natural
don't know if there's a
supplement.
certain brand.
However,
Yes.
all the flavonoids, including luteolin, as powder form, is absorbed less than 10% from the gut. So we're working with a company called Algonaut, created liposomal luteolin by using olive oil. So basically, if you take oil, you put some solid in and you shake it, you give it
Yeah,
energy,
yeah.
it creates small spheres called liposomes.
Okay.
They trap the powder inside and increase absorption by 5 times.
How about if you do it sublingual? I never, we probably won't have time to get into this, but I do a lot of things sublingually and I get very good absorption.
It doesn't get dissolved in water. So you have to dissolve it either in some oil
It's something.
or in the laboratory, we use dimethyl
So like
sulfoxide.
neurofibro, like I think it's called neuroprotect. Like, are you a fan of
Yes.
that? Was the
So I actually helped develop 5 different preparations
right?
with liposomal luteolin.
Okay.
So if I don't know a patient, I say start with something called pure lut because it has 100 milligrams luteolin in olive oil and nothing else.
Mm-hmm.
Okay? If you tolerate that, and if the symptoms are still present, I usually go up to 6 capsules a day. They're tiny little capsules. You can start one a day. In a few days, you can go 1 and 1. You can, 2 and 1.
I mean,
Eventually,
can you take them all at once, or do you need to like space them out through the day, or how about before
usually,
meals? Because a lot of times these people are reacting with
well,
with
the
meals.
flavonoids are gone through the body in about 8 hours. So it makes sense to spread them out somewhat, at least
Mm-hmm.
morning and evening, or morning and
Mm-hmm.
night, etc.
Mm-hmm.
Okay?
Yeah.
And if you swallow the whole capsule, the shell of the capsule protects from the acid in the stomach. So if they tolerate that and they still have symptoms, then I migrate to Neuroprotect because it contains luteolin and quercetin together.
So that's good.
It's much better. But if I don't know a patient, and many patients respond to quercetin adversely, I don't want to hit them with both
Why would
luteolin.
they? Why would they be
I
adverse
don't
to
know. They
course?
tell me they get very hyper, very wired with
Really?
quercetin.
And what about
And
vitamin C? Does that
no
help at all?
problem, doesn't do anything to the mast cells.
Doesn't help. All
No.
right, I'm going to tell you one of my tricks, because I did see a paper on this years ago, and I have used this to some success.
Uh-huh.
I'm curious to think what you think about this. Believe it or not, is sodium bicarbonate or baking soda. And I'll
Using it how?
Okay, so I'll tell you what I do with my patients. So I have them do one or two ways. Either they take a teaspoon of baking soda, put it in a small cup of hot water, um, or I have them swallow like 2 tablets, 650 milligrams. There was a paper years ago, and got me thinking about this, that it was actually from Japan, where there was a patient that was getting, it was very interesting. He had he had exercise wheat anaphylaxis, meaning he could eat wheat and he was okay. He could exercise a little bit. He was okay. If he ate wheat and exercised, he went into anaphylaxis. And they proved that. I mean, that's a syndrome, food-induced exercise and
Okay.
anaphylaxis. And I don't know why the Japanese decided to do this, but they gave him a high amount of bicarbonate and it blocked the reaction. And what they explained, and this is a very old paper,
Mm-hmm.
but they explained that it alkalinized his body, and mast cells like to be in a more acidic environment. So I've
Okay,
used this with
let's
food
stop
allergies.
there. Let's
No,
stop
no
there.
good?
The mast cells, we did actually a pH curve, acidity curve.
Okay.
The mast cells respond between 6.8 and 7.2. If you drop the pH or you increase
If you make it more
the
alkaline,
they just don't respond, period.
that's good.
Well, it's good, but if you give bicarb, my
Yeah.
God, your kidneys are going to take care of that. You're not going to make, your whole body basically change the pH. So I don't understand the reasoning.
Wow.
This
Well,
is used very
I was trying
often,
to alkalize their system.
but
Sometimes
how?
like,
You will alkalize the urine. That's about it.
really?
I mean,
You don't feel like you're really,
as you know, our blood stays at 7.2, give and take pH. You can't go overboard. Uh, and the only time using bicarb may be helpful is in
okay.
patients that have interstitial cystitis, which is a painful sterile bladder
That's right,
disorder.
right. I have patients that have that.
There, giving bicarb does help because it
Yeah.
does change the acidity of the urine. Because you will go to the urine, it's not going to go anywhere else. You're going to pee it off, basically, the bicarb.
But what about when the bicarb gets into your stomach and everything, and it doesn't get absorbed? It doesn't change the pH of your blood?
You will change the pH to some extent of the inside of your stomach, but not your
Yeah.
blood.
Uh,
I mean, it will get into your blood. It's just that
doesn't
the
alkalize
blood
it, like
will
people
correct
always
it very
are.
quickly. I
Yeah,
mean,
because
that's
people are
why
always
we
trying to
measure.
alkalinize their blood too. That's like a whole holistic thing. They're always trying to get a more
No,
alkaline diet, but
it
no.
doesn't do it. At
Okay.
least biochemically, it doesn't do
All
it.
right. Let me ask
Uh,
you one other thing too, because we're
yeah.
running low on time, and I have so many important things to ask you. But Xolair, okay, which is
Yes.
the anti-IgE, and I talked to Dr. Castells about this. I think she's been doing some research on this too. Do you think that has any promise for mast cell activation, or have you used
Not
that
for
with your
mast cell
patients?
activation.
No,
Uh,
for the
Look,
allergy
for
part.
individuals that clearly are allergic and immunoglobulin E is involved,
Yeah,
then it does neutralize the IgE. And
yeah.
when the mast cells don't see IgE, they clamp down on the receptors.
Uh-huh.
And there's no question that the receptors for IgE may be talking to other receptors
Okay.
because even individuals with, for instance, other triggers than typical allergic triggers seem
Mm,
to be doing better by using Xolair.
mm,
For instance, vibration stimulation of the mast cells was shown to be doing better when someone doing Zoller. So what I usually recommend is use either the Pure Loot or the Neuroprotect. It's on Amazon, it's on algonaut.com, etc. Go up to 6 capsules a day, along with your preferred antihistamine that you can kind of go up a little bit 2 or 3 times. Give it about a month to 3 months. That's my basic. Then, depending on the symptoms, if there's chronic itching, then either you can go with Zoller, or you can go with Dupixent, which is a new drug that seems to be blocking, certain molecules. Okay,
Dr. Theoharis, do you think it's very important that that patients are on an H1 and an H2 blocker?
I think yes, because number one, any chronic disease is going to be stressing your stomach. You're going to be releasing more acid. And something that is not known, the mast cells have histamine 2 receptors on the surface. And when the histamine 2 receptors are activated, they stimulate release from mast cells. Therefore, by giving an H2 blocker, you might protect the stomach and reduce reactivity of the mast cells as well. Now, there's let me finish with one molecule that I find very helpful for many reasons. I use berberine sulfate because it's got anti-mold properties, it's got antiviral properties, and there are 2 papers that block mast cells as well. So if everything else fails, or if I have patients exposed to mold, I will add berberine sulfate fairly soon in the course of treatment. If you swallow
Is that just a supplement you can get over the counter?
It's a supplement. Pure Encapsulations has it. Thorn Research has it. It's just that if you open the capsule, it's a little bitter. If you swallow it, there's no problem.
All right, Dr. Theoharis, we spoke so much today. This was action-packed. I just hope our listeners appreciate the amount of expertise you bring to this field. You explain things wonderfully. I'm so glad I got to now actually personally meet you. Is there any last things that you'd like the listeners to know, like where they can find out about your work?
The quickest and easiest way, it's a simple website because I have 2 of them. DR for doctor, and then my whole last name without any underscore or period. So drtheoharides.com. They'll see lots of videos. They'll see PDF files of many publications they can download for free. There's a wonderful section for Q&A. So anytime I get a question from someone, I try to answer it and post it there.
Nice.
And you'll see some videos. I don't want to call them testimonials because they're patients that were really helped and they tell about their story.
Well, that's terrific. Well, like I said at the beginning,
one video that they should see, and if you haven't seen it, I encourage you to see it. If you go to YouTube and look for My Mystery Symptoms and Mast Cells. It's 2 ladies, one from Denmark, one from the United States, that present their symptoms. And I talk about sort of the science of the mast cells and what we can do. It's very old already. It's about 15 years ago.
Oh, wow.
But nothing has really changed very much.
Wow. Well, Dr. Theoharis, I can't thank you enough for coming on. I think you are the master of the mast cell, and
I'm trying.
I always get excited
hard.
when I see, things that you're publishing. So thank you again so much for coming on.
Thank you very much.